Hello, my name is Rosanne Shirazi. I'm a clinical dietitian and a health and wellness specialist here at SummaCare. Today, I'm going to discuss brain health, the role of nutrition and lifestyle. This is important because as we age, keeping our brain active and healthy is so very important as part of our total fitness, and this will directly impact our quality of life. I will define several aspects of brain health, including a definition of cognitive health and several types of dementia, including Alzheimer's disease. I will outline preventive steps for improving your brain health and building your cognitive reserve. One preventive step that I will highlight is the important role of nutrition. I will introduce the MIND diet as one tool to use to include brain protective foods in your diet. The brain is fascinating and complicated. What is provided today just touches on some of the complexities of the brain. I will provide several resources at the end of today's discussion if you want to do additional reading on the subject. Many of us, as we get older, will at one time or another wonder if our brain is normal or if dementia is setting in. One component of a healthy brain is cognitive health. This is our ability to think, learn, and remember clearly. Genetics, the environment, and lifestyle factors can all affect a healthy brain. It's common to be distracted and forgetful from time to time. So sometimes forgetting small things may be perfectly normal. I'm going to go over some of the things that you can look for to see if it might be a concern. Along with cognitive health, there are other components that make up total brain health. Motor function. This is how well we make and control movements, including balance. Emotional function is how well we interpret and respond to our emotions, whether they be pleasant or unpleasant. Tactile function is how well we feel and respond to sensations of touch, including pressure, pain, and temperature. And sensory function is how well we see, hear, taste, and detect odors. They're all important components of the brain, but in this presentation, we're going to focus mostly on cognitive health. Many factors can influence brain health. Age-related changes in the brain is certainly one of them, but also stroke, traumatic brain injury, mood disorders, substance use disorders or addiction, and diseases such as Alzheimer's and dementia. So what is normal aging? There are many factors that can distract us in our busy lifestyle, at any age actually. But as we get older, it's no secret that normal aging can affect the brain. And maybe we will get a little bit more forgetful for some of those small things. We may have a slower processing speed. Our memory and multitasking may be just a little bit slower. We may respond more slowly to sensory stimuli, or we may have a slower motor skill response. All of these changes are subtle and will not interfere with day-to-day function for many of us. I do want you to notice the brain on the right. This is a brain without any disease. And just notice that it's very full, it looks very hydrated and intact. Compare this to the brain with advanced Alzheimer's disease. Notice that the brain is smaller, it's more shriveled, and then there's gaps in the brain matter. This is showing a brain with advanced Alzheimer's. With dementia, and in particular Alzheimer's dementia, there are different stages. In general, again, aging may contribute to a cognitive decline, and not all aspects of aging may result in Alzheimer's disease. But when someone does have Alzheimer's, there's 5 different stages that have been identified from mild to severe. Stages 1 and 2 are very mild. And most people at this stage can still be pretty much independent. But as we get into the higher stages, especially stages 4 and 5, the person is going to need some intervention and total supervision and care. There are various types of dementia, and when you think of dementia, it's an umbrella term, which means that there's many types of dementia that are under that general term. Most of the types are defined by deposits of disruptive proteins in the brain, and the type of protein will vary from the type of dementia that it is. And then these proteins in turn will interfere with brain function. These are the four most common types of dementia that have been identified. The most common, and oftentimes the one that most of us fear, is Alzheimer's disease. And we're going to define this in a little bit more detail. But again, there's abnormal deposits of proteins. The protein is called amyloid plaque. They form plaques. And then there's also tau tangles, which interfere with the brain function. Vascular dementia, which is over here on the right, this is the second most common, and it's caused by blood clots or anything that might disrupt the blood flow to the brain. This is the one that is sometimes related to cigarette smoking, heart disease, such as atherosclerosis, or high blood pressure. Lewy body dementia is another type of dementia, and it is defined by a different type of protein deposit called Lewy bodies, and this in turn can affect the brain's chemical messengers. Lewy bodies has been made popular with the sad story from Robin Williams. This is the type of dementia that he had. And again, it's made the news, and that's actually how I learned a little bit more about it myself. The fourth kind is frontotemporal dementia, and these are deposits of disruptive proteins, different proteins, but they're more in the frontal and temporal lobes of the brain. And there are many causes of this as well, but one of them is head injury. So when we hear about people who have repeated concussions, this may contribute to some of this dementia later in life. I want to spend a couple of minutes talking about Alzheimer's disease, as it's the most common type of dementia. It was discovered back in 1907 by Alois Alzheimer, and he discovered it by doing dissections of brains. So they used the brains after a person died, and he studied the brain to help identify Alzheimer's. Today, 6.2 million Americans have Alzheimer's. At the age of 65, 11.3% people have Alzheimer's. So that's just under 1 in 10. But by the age of 85, 34.6% have Alzheimer's. So by the age of 85, 1 in 3 has the disease. And I think why we're hearing so much more about it is that people are living to be older, so more people are presenting with Alzheimer's. The thing is, though, is that the changes in the brain may begin 20 years before memory and thinking problems develop. So if you're around the age of 35, 40, it's not too early to begin to make preventive changes. Once diagnosed, a person's lifespan is approximately 8 to 10 years. Unfortunately, there's no cure for Alzheimer's. Medications and treatments may slow the progression, but they will not cure it. Now, Alzheimer's is defined by changes in the brain. The changes include amyloid plaques and tau tangles, and these will disrupt neuron functions. Beta amyloid is the protein that causes a sticky plaque, and tau is the name for the twisted fibers in the neurons. These are called neurofibrillary tangles. These can be caused by chronic inflammation and oxidative stress in the brain. Inflammation is the body's natural response to injury and infection. It can be harmful and contribute to chronic disease. So uncontrolled chronic disease, such as heart disease or diabetes, can also contribute to inflammation in the brain. And then tangles and plaque can contribute to inflammation, and the inflammation can increase the prevalence of tangles and plaque. So again, it's kind of compounded as the body is unhealthy. Oxidative stress is caused by unstable molecules or free radicals that accumulate in the body and cause damage to cells. So the brain is especially vulnerable. Oxidative stress is increased by the tangles in plaque, and conversely, the tangles in plaque increase oxidative stress. So the goal is to lessen inflammation and oxidative stress with many controllable factors, including controlling chronic stress and consuming more antioxidants, which the diet and lifestyle recommendations will address. Alzheimer's may now be diagnosed with various tests, including blood tests, which can measure the beta amyloid levels, but also brain scans, such as MRIs and others, and they can actually see the presence of these changes in the brain. And research is continually being done on Alzheimer's risk and Alzheimer's treatments. So as far as Alzheimer risk factors, and a lot of these are also risk factors for other dementias as well, especially vascular dementia. One is over the age of 65. As we mentioned, that as you get older, your risk will greatly increase. Another one that you can't control is your gender, and we find that 2 out of 3 people are females. One of the things that was brought up is that this might be the fact that females compared to men as a population is that they may be less educated, go to school less learning, less career challenges, and so their brain might not be as challenged as men. I would like to disagree with that, but that's what some of the resources have indicated. And then family history, your risk for Alzheimer's doubles if there's a family history. So if you know of a direct blood relative that has Alzheimer's, a parent, a grandparent, aunt, an uncle, your risk will double. And then if you have multiple relatives that have Alzheimer's, then your risk is going to go up even more. So it's really important to be aware of this and to start taking precautions as early as you can. Now, some factors you might be able to control a little bit better. So these are things like high blood pressure, high cholesterol, obesity, metabolic syndrome, and diabetes. High blood pressure and high cholesterol, these also contribute to the vascular dementia. Obesity in midlife. There have been a lot of concerns with the role of obesity in health in general, but contributing to the body-wide inflammation, but also other changes in the brain. And what they find is that when the obesity onset is in midlife, ages 35 to 65, that's when it tends to be the most significant. Remember, it can take 20 years for symptoms to present, as well as the obesity and its contribution to chronic disease and chronic inflammation. So again, at age 35, if you start making changes and reduce your weight and such, then by age 65, hopefully your risk will be reduced. And if you continue those changes in weight management through age 65, then hopefully by age 85, you will not be the 1 in 3 or 2 in 3 statistics that we're seeing. Now, metabolic syndrome, oops, I'm going to go back. Metabolic syndrome is also related to inflammation. And with metabolic syndrome and diabetes, that's usually characterized by insulin resistance, which means our body has the insulin in response to the foods we're eating, but our cells do not respond to it. So usually with our body, we can see that because a lot of times we have the apple shape or we have more fat around our belly. But in the brain, this is true with brain cells as well. to the point where some of the resources for Alzheimer's refer to Alzheimer's as type 3 diabetes, that the insulin resistance in the brain cell is contributing to the plaque and tangles buildup. So the American Diabetes Association does not recognize this as a type of diabetes, but I think it's interesting and underscores why, if you have diabetes, that you need to keep it under control. Smoking contributes to inflammation and blood flow, and again, that's going to contribute to vascular dementia as well. Head injury, especially as related to the frontal lobe dementia, can be a concern. Depression, especially if you have depression in midlife, it does affect the brain function. And then we know that hearing and vision loss. With the diminished senses, the brain is not stimulated, and this can lead to a speeding up of the brain changes. So again, there's so many different risk factors. This is not a conclusive list, but these are some of them that we might want to be aware of, and that might help to inform how we're going to treat our total fitness moving forward. So although there's some risk factors that we cannot control, there are lifestyle changes that we can control, and these may then reduce our risk. We already covered that cognitive fitness is the ability to think, learn, understand, and remember. This includes perception, attention, your memory, motor skills, problem solving, and decision making. Okay, but the cognitive reserve is very important. This is the brain's ability to improve and find alternative ways of completing tasks. We can build and improve our cognitive reserve through mental activities that challenge the brain. This will keep our brain active with new and stimulating activities. So even though our cognitive fitness may start to decline somewhat with age, by having other pathways of thinking and acting can help to protect our brain, and we won't really notice the differences. Some of these things that we can do can be meaningful work, whether it be volunteer work or an actual job as we have, reading, brain games, hobbies. I once had a neurologist tell me that the best thing to do is to read 5 pages a day, book, newspaper, magazine, but just read. Studies show that building your cognitive reserve can prevent or delay degenerative brain changes. So to me, this is very encouraging that we can do something, that we don't have to sit and wait to get Alzheimer's disease. So along with challenging the brain, improved cognitive fitness can be addressed with lifestyle changes such as diet, physical activity, and stress management. The changes can impact not only your brain, but they can also impact your total fitness, including the cardiovascular system, reducing your risk for diabetes and other organs. So keep in mind that a healthy brain is important for a healthy body. There is evidence that the brain protection is the strongest when you adopt healthy habits in middle age. And as we mentioned, beginning around the age of 35, if not sooner, but especially around the age of 35. And the key is that early prevention is going to give you the best outcome. So I want to go over some of the steps to cognitive fitness. These are from a resource from Harvard Medical School, and they have a guide that you can look at, and it's called A Guide to Cognitive Fitness, 7 Steps to Optimizing Brain Function and Improving Brain Health. And it's a little booklet, and they had a lot of really good information if that's something that you want to read a little bit more on. But there's a lot of ongoing research and recommendations, not only how to prevent dementia, but to actually improve your cognitive fitness. The research shows that most risks of cognitive decline can be addressed with lifestyle changes. The changes to improve your brain health can also impact your overall health, including reducing the effects of high blood pressure, diabetes, and cardiovascular disease. The goal is not only to live longer, but to live longer with cognitive function intact. So we want to keep our brain healthy as we age as well. So now as we go through these steps, keep in mind that all of the steps are important, and together they can lead to positive changes in brain function and brain structure. Okay. So first I want to talk about a plant-based diet. In addition to the food choices that you make, your food choices should consist of a variety of plant-based foods, and these are going to include fruits and vegetables and whole grains. But in addition to that, portion sizes are also very important because that will help you to control your weight and possibly control some of the ingredients that might be in the diet that might be detrimental if you eat too many of them. I do want to mention that hydration is very important for optimum brain function, as most of the weight of the brain is made up of water. Dehydration can lead to fatigue, headache, dullness, and confusion if severe. Water is our preferred beverage. We really want to try and avoid artificially sweetened beverages. Now, a plant-based diet provides healthy nutrients, including vitamins, minerals, and phytonutrients that act as antioxidants, as well as fiber, prebiotics, and probiotics, and these will support the gut microbiome or the bacteria in our colon. And we find that this bacteria actually has a profound impact on our brain health. Moreover, a plant-based diet is lower in saturated fat, which will help reduce inflammation and help reduce our risk for heart disease. Additional guidelines for a desirable meal plan. So stay tuned. The next step is regular exercise. It is one of the best things that you can do to reduce your risk of developing dementia. Research has shown that people who exercise regularly may be up to 20% less likely to develop dementia than those who don't. So that's really significant. And then the exercise and the eating together will help to contribute to the weight management. I just want to mention that all types of exercises is important. Certainly the cardiovascular exercise where you raise your heart rate is known to be very important, but also strength exercises, flexibility, and balance exercises. We want to help prevent falls so that we don't hit our head, which could cause some brain damage. So usually what the sources here recommend are the same sources that we recommend for exercise in general, which is you want cardio exercises to be 150 minutes a week, which is about 30 minutes a day, if you can do that 5 days a week as a minimum. And then strength training should be 2 to 3 times a week. Flexibility and balance should be every day. So again, you want to incorporate just regular activity as part of your lifestyle. And as I mentioned, that plus exercise will help with weight control. And as we mentioned, obesity, especially if it begins in midlife around ages 35 to 65, is a significant underlying cause of brain damage. The research will suggest that the gray matter in the brain will shrink, and then the excess belly fat, in addition, will promote inflammation. And as we determined, inflammation can also further damage the brain. So the neurons and the brain hormones will be disrupted related to obesity. And then again, the vascular changes that restrict the blood flow to the brain will be affected, and it will also affect the gut microbiome, that healthy bacteria. And again, this has been linked significantly to brain health. Healthy eating and exercise will promote a healthy weight, and together they are a strong component in maintaining cognitive fitness. So I can't say enough about that. Next, we want to get enough sleep. Inadequate sleep and poor sleep quality can affect memory by disrupting REM or REM sleep. This in turn may increase your risk of Alzheimer's disease. And again, at the short term, it's going to affect your memory. Long term, it can increase your risk for Alzheimer's. Inadequate sleep can affect brain hormones and contributes to other chronic diseases. that other chronic diseases that also affect brain health. Again, diabetes, obesity, cardiovascular disease. Sleep apnea should be assessed and treated if it's found to disrupt the quality of the sleep. So it's important to address issues that may be affecting your sleep quality through improved sleep hygiene and talking to your doctor. Hopefully you can improve the quality of your sleep so that you don't see these changes and you'll feel better overall. The next step is to manage your stress. I mean, we all have stress. We're at work, stress is just part of work. But if we have chronic stress, this can change the brain's function and structure. The stress hormone, including cortisol, can contribute to fatigue, depression, and anxiety, which all contribute to inflammation. It contributes to elevated blood glucose and insulin resistance, and as mentioned, the insulin resistance in the brain. This can have a systemic effect on overall health, including reducing cognitive fitness. It's important to practice ways to manage stress, and there are so many ways, and you need to find a way that's right for you. But this can include deep breathing, meditation, maybe embracing nature, praying. There are many ways to combat the effects of stress. The next step is to challenge your brain. The more you stimulate your brain, the lower your risk of dementia. The earlier you begin, the better. People who are more educated tend to have a lower risk for dementia, as are lifelong learners. And it doesn't necessarily have to be, a degree at a college. It can be just taking a class, learning something new, reading a book. But the more educated that we are, we have less risk for dementia. Um, it can be learning a new skill, a game, or a hobby. Maybe doing some puzzles or studying a new language. You can challenge yourself to approach something routine in a new way. Maybe change up your workout. So if you're always used to going and hopping on the treadmill for 30 minutes, maybe you can go on a bike instead, or maybe you can take a walk instead, not on a treadmill, or use some weights. Your body is going to have to make new connections to remember and practice those new moves. Or maybe it's taking a new route to work, seeing some different scenery. If you like to hike, going a different way on your hike. But any of these little changes can challenge your brain. Music has been found to improve cognitive fitness as well. And all of these examples will help to improve your cognitive reserve. Remember, the cognitive reserve is the mechanism where you can offset some of the normal changes due to aging. Another thing that's very important with cognitive fitness, and that is nurturing your social contacts. We know that when you have social contacts, when you're talking with other people, interacting with other people, this will stimulate and challenge your brain. We know that people who are lonely or isolated, they have rapid cognitive losses. So we want to try, and if you know someone who is a little bit isolated or lonely, you want to try and pull them out. You want to yourself keep active so that you can, maintain those social contacts. Social activities cause the brain to engage in attention and memory activities. So again, that's going to help with building that cognitive reserve. Playing games with others, volunteering in an educational capacity, conversations with friends and family, and this can even be on the phone, group classes, dancing in a group, and team sports. Possibly this is one of the reasons why pickleball has become so popular among seniors. It's a great physical activity, it's a new activity, and again, it's very social as you're working with other people. So any activity that you enjoy where you can interact with others can help to nurture the social contact. So that's something that's very important as people age. And then finally, identifying your purpose. and basically kind of identifying your why. What is your purpose? Articulate your purpose in life. Um, this is usually having something to look forward to, a meaning for your life. Maybe it has to do with your family, your children, or your grandchildren. Maybe it has to do with giving back in volunteer activities. Maybe it has to do with making an impact in your community, or being engaged in your religious beliefs. It's just very important that you have a purpose. And going along with that is having an optimistic outlook. This certainly can reduce the risk of dementia. And we know that optimism can be learned. If you're a pessimist, you need to work kind of hard at it, but you can have an optimistic outlook if you work at it. And part of that is, again, some of the other things we talked about, like social contacts and challenging your brain, learning new things, but just engaging in enjoyable activities. Nurture gratitude, be happy, laugh often. Laughter is the best medicine, they sometimes say. But all of these things will help you to identify your purpose, give you your why. What is your reason? What are you wanting to achieve in your life? So all of these steps are important to promote cognitive fitness and thereby prevent or delay the onset of dementia. Together, they can lead to positive changes in brain function and structure. So just be aware of these and work towards increasing these in your lifestyle for your cognitive fitness. And I think as most of us go through our day, the seasons of our life, that we may need to work on one or more of these at a time more than the others. But hopefully, overall, there's going to be a balance where at least all of these will be touched on your way to cognitive fitness. Okay, so now I want to get into the actual diet recommendations, and some tips for defining what a diet might look like that's beneficial. So there are many recommended meal plans. Again, we mentioned the plant-based diets. That plant-based diets in general reduce Alzheimer's progression and can slow cognitive decline. And the reason why is that these are very rich in antioxidants that helps to combat that oxidative stress that can damage the brain. And they're very rich in other phytonutrients that again have very protective benefits to the brain and elsewhere in our body. Plant-based diets are high in fiber, and these help to support your gut health. It helps support a healthy microbiome. And then these tend to be lower in saturated fat, which help protect our cardiovascular system, which, as we mentioned, that will also help to protect our brain. So plant-based diets in general is considered to be the way that we are starting to recommend that we eat for a variety of different reasons. Now, plant-based diet does not need to be vegetarian. You can have some meat in the diet, but we want to be careful how much meat, fish, chicken, and how often. Okay. So the MIND diet is the one that I'm going to introduce at this time. MIND is an acronym. It stands for the Mediterranean Dash Intervention for Neurodegenerative Delay, MIND. And what's interesting with this is that it includes the Mediterranean and the DASH diets. The Mediterranean diets have been promoted for years. The American Heart Association recommends the Mediterranean diet as being a very good diet to help with longevity and cognition. Okay, and this diet can lower blood pressure and reduce the risk of heart disease and diabetes. The DASH diet stands for Dietary Approaches to Stop Hypertension. So this one is for people who do have hypertension they're trying to control. It's very similar to the Mediterranean, as it's also a plant-based diet, but it has a little bit more of a focus on reducing your sodium intake and increasing your calcium and potassium. And then the MIND diet takes it a step further, and it specifically will include foods that science has suggested will support the brain health. So if you're used to following the Mediterranean diet, it's not going to be very different to just add a few things to make it into the MIND diet. Okay. Just a little side note here is that the MIND diet is relatively new. It was outlined beginning in 2016 by scientist Dr. Martha Claire Morris in her research teams at Rush University and the Harvard T.H. Chan School of Public Health. So she actually has books that she writes that will go over specifically the foods and how much and how often. But it's really a good resource. But if you were to Google the MIND diet, you'll find some good information on that if you want more specifics. But again, it's been well studied. It continues to be studied, and it's really found to be beneficial for us on many levels. Now, with the MIND diet, they include 10 foods to include and 5 foods to avoid. So these are the foods to include. And once again, if you've ever followed the Mediterranean diet or are familiar with it, these are pretty much the same foods that you're going to see on that, which is a little bit of a different twist. So we have green leafy vegetables. For example, like a green salad would be great to include, or cooked spinach, something similar to that. All other vegetables, especially the non-starchy, nutrient-dense veggies. The starchy vegetables are fine. They do have nutrition, but they're going to add extra calories. And if you're also trying to lose a little bit of weight, you want to try and lean towards those that don't have as much calories for the amount of nutrition. These are going to include things like broccoli, cauliflower, carrots, tomatoes, zucchini, and a variety of other non-starchy vegetables. Berries are great to include, and especially blueberries have been implicated with improved brain health. Nuts, especially walnuts, same thing, that those have been identified not only with heart health, but also with brain health as well. And it's believed because that the type of fat that's in walnuts can convert into omega-3 fatty acids in the body. So walnuts are a healthy nut. It's easy to go ahead and throw some onto your oatmeal in the morning or in your yogurt if you like it like that. Olive oil should be the main cooking oil that we use. Whole grains, and then these are going to include 100% whole wheat products, but also things like quinoa and farro and oatmeal and barley, that we don't want a lot of processed white grains. We want them to be high fiber whole grains. Fish. You want to choose omega-3 rich fish at least one time a week, and that would be tuna or salmon, for example. Beans, and this is going to include lentils. Beans and lentils, sometimes they're called legumes, but they should be incorporated into your diet on a regular basis, whether as a side dish or added into other foods. But they're found to be very healthy, high in fiber. They're a great prebiotic. They help with our healthy gut. Poultry, the leaner the better, but the important thing is not fried. And I should go up with fish too. You know, you don't want to do a fish fry. That's really kind of almost doesn't count. So baked, broiled, sautéed are better ways to have fish and poultry. Now, with this, coffee and tea are on this list. They're highlighted because small amounts of coffee and tea can actually be beneficial, especially if consumed earlier in the day. That they can actually promote memory, energy level, and so they're found to be helpful with brain health. Tea, especially with green tea, it does have antioxidant benefits, so that would be a great tea to include if you do like that. We want to be cautious not to have a lot of caffeine later in the day because then that's going to interfere with our sleep. So again, when they recommend it, they usually recommend a cup or two earlier in the day. Wine, this is kind of optional, but if you do have wine, you want red wine preferably, or if you don't want the alcohol, dark grape juice. This has to do, it has a powerful antioxidant in that, which has a protective benefit. And then also, it's not on my list, but I added water. Again, we mentioned that water is super important because it maintains hydration. And you want plain water as your primary beverage, as opposed to those that contain a lot of sugar or that can contain artificial sweeteners. Artificial sweeteners are really not found to be healthy on many levels, including with brain health. Now, there's 5 foods that we want to limit. So we want to limit butter and margarine. Butter, we're going to see butter in smaller amounts, like a tablespoon a day. Margarine, you want to try and avoid altogether, unless it's a margarine that's has the plant sterols in it, like Benecol or some of those that are for heart healthy. But a typical margarine is really not beneficial. It's synthesized, so studies are finding that that's not our friend. We want to try and limit cheeses, especially the hard cheeses. We want to limit red meat, especially the high fat, saturated fat cuts of red meat. We want to limit all fried foods, including French fries, fried fish, fried chicken. And we want to try and limit pastries and sweets. Now, notice I'm saying limit, not totally eliminating our diet, but the less you have, the better. In general, you want to avoid or limit ultra processed foods. These are highly processed foods, and the picture that I have there shows many of those that we are faced with on a day-to-day basis. Many foods are processed, so it's difficult to have no processed foods in the diet. For example, oatmeal, rolled oats, that even though they're old-fashioned, they're still processed. They're taken off of the branch, from the field, and they're processed and packaged and put into a container that we buy at the store. That's going to be different than the oatmeal that's in a little packet where they add, brown sugar or maple syrup or other flavorings and additives and things such as that. Okay. Ultra processed foods are very high in saturated fat and sugar. They are very calorie dense, and oftentimes that they can contribute to insulin resistance. So it can help to keep us hungry, and overall they're going to contribute to weight gain. So if you just do one thing in your diet and get off of the ultra processed foods, the extra fat, the extra sugar, you'll probably see some positive results. So this is just a little summary of the MIND diet, and to give you an example of how to put that all together. And again, if you were to Google the MIND diet, you could get this information online. There's a lot of good resources on this. But multiple times every day, you should have some olive oil. So it could start out with breakfast. Let's say you do have an egg, you can go ahead and cook it in a little bit of olive oil. Or if you have avocado toast, you can sprinkle a little bit of olive oil on the top of your avocado toast, for example. With lunches, you can use olive oil as your salad dressing. Make your own salad dressings with an olive oil base. For dinner time, again, if you're cooking some food, go ahead and drizzle that with some olive oil. Some people will also use olive oil in place of butter, and they'll use it like as a dip. They'll season it with herbs and spices and dip their bread into it. So again, olive oil should be your primary oil. And then whole grains should be the type of grains that you eat. And for most people, about 3 servings a day would be a good amount to have, a prudent amount that will give you enough of the beneficial nutrients in them. So now we have eat every day. So again, green leafy vegetables, an easy way to do that is to have 1 salad a day. I know a lot of people will do that as a lunch, and they'll put a little bit of protein in it, for example. Other vegetables have at least 1 serving a day, all those low calorie vegetables. And it can be more, but at least 1 serving a day. Nuts, try and have 1 serving a day of nuts, preferably walnuts. Almonds is another good alternative, or a mixed nut. But again, walnuts do have a little bit of more of a benefit. And then if you do drink wine, red wine or dark grape juice, but only 1 5-ounce glass per day. So we're not talking large amounts here. Then every week, you want to try to have legumes, beans, and lentils. 3 to 4 servings per week is a good guideline for that. And more is okay, but try and have at least 3 to 4 servings per week. Poultry, especially the white meat poultry or very lean ground turkey, such as 90% lean or higher. You can have 2 servings a week, and a serving being about 3 to 4 ounces after it's cooked. Fish, you should have 1 or more servings per week. And as we mentioned, at least one of those should be an omega-3 fatty acid fish if you can. So have fish, tuna, salmon, other fish throughout the week. Fruits are berries are important. All fruits are healthy, but berries are especially important, including blueberries, and you should have at least 2 or more servings per week. Blueberries, as I mentioned, have a protective brain benefit, and so if you like the blueberries, include those. Have a variety, and you can have them every day, but at least have 2 servings a week. Now, what we should avoid eating every day, butter, not more than 1 tablespoon a day, and ideally never eat margarine. And then avoid eating as much as possible. And again, it doesn't say eliminate from your diet unless you want to, but you need to use a little bit of willpower to limit the amounts of some of these foods. Pastries and sweets, less than 5 servings per week. So maybe you'll want to save them for special occasion. Red meats, fewer than 4 servings a week. And even with the red meats that you choose, you should get the leanest cuts that you can. Cheese, and again, hard cheeses especially, such as cheddar, 1 serving or less per week. If you do have cheese, try and get a low-fat variety like low-fat feta or maybe part skim mozzarella cheese. And then fried or fast food, try and have less than 1 serving per week. So in summary, we just talked about brain health and all the things that we can do in order to help to improve our brain health. And we want to remember that with age, there's a normal decline in brain health. But by keeping our brain active and healthy, we can accommodate these changes with little interruption of day-to-day function. And over here on the right is a reminder of the several identified lifestyle measures that we can take to prevent or slow the effects of dementia. And this includes Alzheimer's dementia. You might not be able to totally prevent it if you have a strong family history, but maybe you can delay the onset. For our diet, research has identified a plant-based diet to be the most beneficial. And I provided some different examples of plant-based diets that are relatively easy to follow. And this is the MIND diet, which is the Mediterranean intervention for neurodegenerative delay. And it combines diet recommendations that affect the whole person, including the brain. I just want to leave you with this. A healthy brain is important for a healthy body, and a healthy body is important for a healthy brain. These are just a couple of resources that you might want to look up, and there are so many that are out there. I looked at the Harvard Health Letter. I saw many resources through Harvard, and if you were to Google these topics, you'll probably see references from Harvard show up on your search. But Alzheimer's.gov, this is a great federal website, if you will, that has good research and information that you can look at. The Alzheimer's Association is another, and the Alzheimer's Foundation of America is a third. And again, this is not a conclusive list, but these are just some that I have found had really good, interesting to read information. Quickly, I just want to go over some of your SummaCare resources, and I want to emphasize that you need to review your plan documents to see which ones SummaCare provides to your workplace. But you are eligible for an annual visit with your primary care provider. You may be eligible for conditioning care management and health coaching. These are telephonic services that nurses and or myself, a dietitian, can help you with over the phone. WebMD is a resource that you can access online. You may have access to a 24-hour nurse line where you can ask questions before going to like an urgent care, for example. You have teledoc. You may have teledoc. You may have smoking cessation, and you may have the Husk Health and Wellness discount. This is pretty much just a resource that it will list different discounts that SummaCare provides, and it will show different memberships and such in your community that you may be eligible for. And I just want to thank you for your for being here today. I really appreciate being able to share this information with you, and hopefully you learned a little something that will help you keep your brain healthy.